online predators preying on children probably is not that common. It's more older teens and young men, some older men, but young men striking up conversations and trying to lure in younger teens. And it has more consistency with a statutory rape kind of a approach rather than pedophiles trying to lure child molesters. So the messages that are probably most helpful are that rather than blanket kinds of admonitions about never talk to strangers, which that's not really realistic on the internet because people are going to go to your Facebook page and you don't know them, and you have to decide whether to have a conversation or not. A more specific type of advice that would be helpful is don't talk about sexual matters to strangers. But plenty of personal information gets posted on Facebook and various pages. The other way to target messages is towards youth that are specifically at risk. These would be youth that have been abused physically or sexually, sexual minorities, transgender, folks that are confused about their orientation. I'm talking people that are, say, 12 to 17 years old. If they're confused about their sexual orientation, they're often online trying to get more information, willing to talk to people, older people who they see as more knowledgeable. These are the higher risk populations that need more monitoring and more specific advice about how to avoid the pitfalls that are on the internet. What is child pornography? Well, it's a visual depiction of a minor engaged in sexually explicit conduct. It doesn't have to be a real victim. Photoshop, even cartoons. Believe it or not, there's a man in Virginia that's serving a lengthy prison sentence because of a anime, Asian art depicting sexual interaction between adult and child. The Supreme Court has ruled that those depictions qualify as child porn. You can get in plenty of trouble. It has to cross state lines, which if it's on the internet, it probably did, for federal prosecution. There is an affirmative defense. If you only have one or two pictures, you could make a reasonable case. It was in some other file, it's accidental. I've actually seen one or two patients who that was apparently the case. But a quick overview of child pornography offenders. Vast majority males, vast majority. Sex offenders in general, maybe 90% are male, 95% male, only 5% female approximately. But of child pornography offenders, vast majority male, 99%. Disproportionately Caucasian, average or higher intelligence, better educated. And in terms of a history of physical or sexual abuse, contact, that is hands-on molesters, have more of a history of physical or sexual abuse in their own history than child pornography offenders, and both have more of this kind of abuse history than normals. What makes them tick? What are their motivations? Well, they are often, if they're in possession of child porn, they very well may be pedophiles, so that's what's driving it. Could have indiscriminate, they really don't care who or what they have sexual contact with, sexual addiction or pornography, curiosity, sexting. These are all reasons that come up in the literature. Accidental access. Justification is looking for support that this is an okay thing to do, it's not that bad. A sense of preserving child's youth. To lower their inhibitions, essentially grooming could be used for, blackmail, medium of exchange, profit. When you actually ask, let's ask the offenders themselves, they say, yes, it is. It's a sexual interest. It is the pedophilia, sexual interest in children. Some say curiosity, a few say accidental access, rather few say that they're addicted to internet, or that child porn is a substitute for contact offending or just indiscriminate interest. A psychosexual evaluation really requires multiple data points. If you think you can just sit and talk to someone who's been accused of a sexual offense and get all the data you need, sadly mistaken. This is why the collateral interviews are so important. It's so important to be able to talk to somebody who's actually lived with this offender or someone who's accused of being offended. Find out what kind of sexual habits they have, what kind of sexual tastes they have, how they react when they don't get their way sexually, how controlling they are they preoccupied? These are what collateral interviews can give us. Different kinds of psychological test data. Dr. Janner covered quite a variety there. The reality is most of us pick a handful of tests, and those are the ones that we like to stick with. So many of our tests, especially all the paper and pencil tests, they're essentially subjective. You know, they can be objectively scored, but they're really dependent on self-report. If you need to find out if someone is sexually attracted to children, you can ask. But here's a newsflash. A lot of people lie about that. Well, you know what? We all lie when we know we've done something wrong. How many of us, when we've gotten pulled over by the traffic cop and are asked, do you realize how fast you were going? How many of us are going to say, yes, officer, I do realize how fast I was going? And you know what? It's not the first time I've driven over the speed limit either. No, most of us are going to go, absolutely not. I have no idea I was going that fast. I'm so embarrassed. Sex offenders lie just like all the rest of us, so we need some other way to try to figure out whether they're telling the truth and on this specific topic. We really only have 3 objective tools. We have a polygraph. I'm going to talk about that in a little bit. We have the penile plethysmograph. This is where the penis is actually hooked up to monitoring devices, strain gauge. You're exposed to some deviant material, pictures or audio depictions of deviant sex act, and then see if you get some genital arousal. That's a pretty good way. It's very invasive. We don't do that. I don't know anybody in Central Florida that does that. I think it might be done up in Gainesville. Some centers in Atlanta, New York, California do that. Still, it's an older method. It's an old method, but pretty good. The ABLE assessment for sexual interest, we're up to the 3rd version, third edition of it now, is an excellent test that I have testified on dozens of times and never been prohibited from giving my testimony. As we showed you earlier, the authorities are not fooling around. They're passing out 4, 5, and 6-year prison sentence to kids that are 18, 19, and 20 years old in a heartbeat. All right. Really, the polygraph, again, is just measuring anxiety, cardiovascular, respiration, galvanic skin response. A couple of ways to do a polygraph. I'm pretty much done with polygraph. You can ask more questions later if you like. Pedophilic disorder, so this is what it's now called in DSM-5. Instead of pedophilia, they changed it to pedophilic disorder. I'm not impressed with the change, are you? They didn't change anything else except the name of it. So pedophilia or pedophilic disorder, recurrent intense sexually arousing fantasies, urges or behaviors lasting at least 6 months. Again, pedophilia defined as sexual interest, prepubescent generally defined as age 13 and under. You can use some specifiers, and you must be 16 to get this diagnosis, 5 years older than your victim. Other diagnoses, I think we've covered that. Failure on conditional release. I want to point out there's different kinds of recidivism. You know, if you hear that sex offenders recidivate, half of them eventually recidivate. Well, what does it really mean? Well, look, there's different kinds of recidivism. Sexual recidivism means going back and committing a new sexual offense. That's what we're especially interested in. Did they violate their probation by failing to register or violating their curfew or missing too many therapy sessions? Those are more technical violations. They can violate you for that. That would count as recidivism. So, or did they go out and commit a robbery? That's criminal recidivism. So there's different ways of defining it. Sexual recidivism is actually low in most sex offenses. You can go to the U.S. Department of Justice website and see recidivism rates for different kinds of felonies. Sex offender, the average recidivism rate for criminals in general, assault, drug abuse, violence, and so forth, 50% and above. That means over half of the people you lock up, let them go, within 3 to 5 years, they're right back in the prison doing similar offenses. Sex offenders, closer to 15%, much lower. They're much lower risk of recidivism, but 1 in 4 eventually does recidivate. Content is important. This is the beauty of the computer capturing everything that you went to look at. Now the confounding factor is when you get a file of somebody else's collection, you get their entire file imported into your computer. There may be children in there that are being tortured or something, and you may go, oh my gosh, I didn't like that, I don't want that. That's horribly gross to even a pedophile maybe, but it's on your computer. But in general, apart from that exception, if you've gotten more and more of the same kind of porn, well, that means you're interested in that kind of porn. And the younger they are, the more of a concern it is, and the more boys in there, the worse the prognosis is, the more likely recidivism. Treatment, cognitive behavioral. I ran groups for 20 years out of my office. I do individual now. It works. This just shows you it works. Generally can bring down recidivism from 15 to 20% down to the 10% range. If they complete, this is critical, they have to complete the therapy. It can be arbitrary. So therapy might last 1 year, it might last 5 years. But whatever the therapist says they need, that's what they need. They need to complete that therapy. Dropping out, horrible prognostic sign. Relapse prevention is a sort of a specific application of cognitive behavioral therapy. We help them identify high-risk situations. I've got a procedure that I call craving management. Went to a specific workshop on craving management and impulse control, certain skills that they learn to avoid high-risk situations and to deal with cravings. Identifying thinking errors, and helping with cognitive restructuring around the thinking errors, such as sex with a 12 or 13-year-old is not that bad. By the way, laws of consent vary widely across the country. Here in Florida, 18, most of the country 18, some states 16, Colorado 16, some states lower, Idaho 14, most of Canada 14 legal age of consent. So cognitive structuring might be done a little differently in those states, but deepening victim empathy. Victim empathy maybe doesn't, and denial actually don't load on recidivism risk all that much. They do some, and I think it's worthwhile. There's certain exercises, letter writing exercises, unsent letters to the victim's parents, unsent, of course, to see how they're thinking. I have them sometimes review and react to certain films. Y'all familiar with Kevin Bacon in The Woodsman? This is a great film. He is playing a released sex offender. Life is hell. And he deals with relapse risk. How do they process this? A standard series of questions that kind of go with the film. This is the kind of work we do in therapy. I've been doing this therapy for 25 or 30 years. I think I can count on 2 hands the number of recidivism, the number of people that went back and committed a new sex offense either during therapy or shortly after. So my experience is that they're a pretty good risk, as long as they're in therapy or complete their therapy. We're big on self-regulation, and that's why I like to see them in therapy over a period of time, not just a few months, if at all possible. There's some other therapy models. Good Lives is kind of the idea that sex offenders want the same things we want. How do you get there? Well, being responsible, showing up for work, meeting your obligations, not doing everything just because doing things just because they feel good, like substance abuse. Well, I want to go back again and reiterate that, yes, sex offenders keep doing their offenses until they get caught. They will keep. It's just like drug abuse. They keep doing it. It feels good until they get caught. But once they get caught, have to look at their families, have to look at the devastation, lose their job. Sometimes it's a misdemeanor. Maybe soliciting a prostitute off of Craigslist cost them their job, cost them their wife and family. Their whole life crumbles over a misdemeanor.
This is the largest to date on internet sex offenders. This involves both child porn and also travelers, but the majority is child porn. What they found, and this is 21 separate studies with 4,464 individual internet offenders, what they found is that 55% admitted retrospectively to contact offenses and self-report. This is what I tell all the prosecutors and the people that ask me about this. He's got child porn. Does this mean he's going to go out and touch his daughter? No, the risk here really is that he already has touched his daughter. So 55% as compared to the rates that we were talking about in terms of general offense recidivism and sex offender recidivism is astronomical. So the cases, if we're doing defense work, the cases we like is when they come in, they said, I look at child porn, okay, you're right. I've never touched anybody though, and I never would. Immediately, you go and get a polygraph and say, okay, prove that to me. If you can prove that, then we can make a pretty good case for you. Not that it's our job to make the case, but we can say that from here on out, going forward, in this research, with 9 studies, 2,630 people, we follow you after we catch you with child porn. 1.5 to 6 years from now, there's a 2% chance, only 2%, that you're going to go out and offend. You're going to go out and have a contact sex offense. 3.4% chance that in that time frame you're going to go off and get caught with more child porn. So I think those are important numbers because previously, particularly in the Buntner study, they were coming out with data that were very much at odds with this. And it's a widely cited study by the prosecution used to show how bad these people are and how highly they recidivate. But it was based really on some faulty methodologies. These people are essentially, in my estimation, coerced to admit to retrospective abuse. The juveniles that I see, they've gotten into trouble for sexting. This is freakishly common at this point, that people are sending pictures of themselves naked to their girlfriend or boyfriend. And as Dr. Greco implied earlier, once they have the messy breakup, those pictures just get spread all over school. 8% of contact offenders, juvenile contact offenders, reoffend in 5 years, which is lower than the contact offender rate, overall contact offender rate over the same period. However, violent recidivism in juveniles is much, much higher. This is one way where we know treatment is helpful with juveniles, anger management specifically. Specific tools for the juvenile sex offender. We don't have an actual validated actuarial measure like we do with the Static 99 for juvenile sex offenders. With the Static 99, we can essentially say, given these number of factors, this guy has an X% chance of reoffending in X number of years. We can't get that specific with the juvenile sex offenders. They're just too variable. Hard to get a thumb on them, get them understood. But what we have instead are these sort of clinical judgment lists, and essentially what this is somebody went out there, combed through all the research, and said these are the things that are at least positively correlated with recidivism. So these are the things that you want to address in your report. These are the factors that you want to look at. The two that we use most often is the E-RACER, which is the estimated risk of adolescent sex offender recidivism, and the JSOAP-2, which is the Juvenile Sex Offender Assessment Protocol. One of those, I believe it is the JSOAP-2, can be used prior to adjudication. The other one you have to wait until they're convicted. Don't quote me on that, but it's one of those two. There's also the JSORAT-2. This is less common. It's a Juvenile Sex Offender Risk Recidivism Assessment Tool. Just love these acronyms. There's also something called the Protective Factors Scale. This is a newer instrument. The 3 protective factors are sexuality, that is deviant or compulsive, personal development, that is essentially pro-social development, and environmental support. When we treat juvenile sex offenders, we always have to take in considerable consideration the family environment, as well as, if we can, the community around them, their school. I also want to note sexual preferences tend to vary over time. It's hard to say, even if we find what we probably couldn't technically diagnose as a pedophilia, because the adolescent would have to be at least 16 and have to be attracted to at least 10 or younger. But anyway, even if we get those indications on the ABLE, which we can administer to the adolescents, it's really difficult to say that this sort of deviant interest is going to be there in 2 years, 4 years, 10 years when the kid's 35.